Welcome to MCQtestPrep. Are you ready to test your CNA skills for 2026? In this video, you'll practice 20 important basic nursing skills questions designed to help you prepare for the Certified Nursing Assistant exam. Challenge yourself, check your knowledge, and let's get started. Question 1. CNA exam alert. Don't miss this important question. A resident recovering from hip surgery asks to get out of bed for the first time. Before assisting, what is the CNA's priority action? A. Verify that the nurse has approved the transfer and gather any required assistive devices. B. Encourage the resident to stand immediately to build confidence. C. Raise the bed to its highest position before beginning. D. Ask the resident to walk independently to assess strength. Answer A. The CNA should confirm that the transfer is authorized, review any precautions, and prepare the appropriate equipment such as a gait belt or walker. Safe preparation reduces the risk of falls and injury. Question 2. Future CNAs, stay focused on this one. While assisting a resident with lunch, the CNA notices the resident suddenly coughs repeatedly and cannot speak. What should the CNA do first? A. Offer the resident water. B. Follow facility protocol for a choking emergency and summon immediate assistance. C. Encourage the resident to finish chewing. D. Leave briefly to find another staff member before assessing the resident. Answer B. An inability to speak combined with severe coughing may indicate airway obstruction. The CNA should immediately follow emergency procedures, call for help, and respond according to training without delaying care. Question 3. This basic nursing skill is a must-know. During a bed bath, the CNA observes a new red area over the resident's sacrum that does not blanch when lightly pressed. What is the most appropriate action? A. Massage the reddened area to improve circulation. B. Cover the area with a warm towel and continue bathing. C. Document it later if it becomes worse. D. Report the finding promptly to the nurse and avoid additional pressure on the area. Answer D. Non-blanchable redness may indicate the beginning of a pressure injury. Early reporting allows prompt assessment and intervention. Massaging reddened skin can cause additional tissue damage. Question 4. Think like a certified nursing assistant before answering. A resident who normally walks independently says, "I feel dizzy when I stand up." What should the CNA do? A. Assist the resident to sit down safely and notify the nurse. B. Encourage the resident to keep walking slowly. C. Tell the resident dizziness is expected. D. Leave the resident standing while getting a wheelchair. Answer A. Dizziness increases the risk of falls. The CNA should immediately help the resident sit or lie down safely and inform the nurse for further evaluation. Question 5. This question could appear on your CNA exam. A resident with limited hand strength wants to feed themselves. Which action best promotes independence? A. Feed the resident as quickly as possible. B. Wait until the meal is over and then offer assistance. C. Provide adaptive utensils and encourage the resident to do as much as possible independently. D. Ask another resident to help with feeding. Answer C. CNAs should encourage independence whenever safely possible. Adaptive equipment allows residents to maintain function and dignity while receiving only the assistance they truly need. Question 6. Pay attention, every detail matters in patient care. Which observation should the CNA report to the nurse immediately? A. A resident requests an extra blanket. B. A resident's urine is suddenly dark red during toileting. C. A resident chooses not to watch television. D. A resident finishes breakfast more slowly than usual. Answer B. Blood-colored urine is an abnormal finding that may indicate bleeding or another serious medical condition requiring prompt nursing assessment. Question 7. Let's test your basic nursing skills knowledge. Before transferring a resident from the bed to a wheelchair, why should the CNA lock both the bed and wheelchair brakes? A. To prevent unnecessary noise. B. To make the transfer faster. C. To prevent movement that could cause the resident to fall. D. To improve resident comfort only. Answer C. Locked brakes prevent equipment from rolling during transfers, significantly reducing the risk of falls and injuries for both the resident and caregiver. Question 8. Many students miss questions like this one. While measuring a resident's intake and output, the CNA notes that the resident drank 240 milliliters of juice and 120 milliliters of water. How much fluid intake should be recorded? A. 300 milliliters. B. 240 milliliters. C. 360 milliliters. D. 420 milliliters. Answer C. Total fluid intake equals the sum of all liquids consumed. 240 milliliters plus 120 milliliters equals 360 milliliters. Accurate documentation is important for monitoring hydration. Question 9. Patient safety starts with the right answer. A resident becomes upset after receiving difficult news from a family member. What is the CNA's best response? A. Tell the resident to stop worrying. B. Change the subject immediately. C. Leave the room to give complete privacy without checking back. D. Listen respectfully, acknowledge the resident's feelings, and report concerns when appropriate. Answer D. Active listening and empathy provide emotional support while respecting the resident's dignity. Significant emotional changes should be communicated to the nurse when appropriate. Question 10. Can you choose the best nursing action? While making an occupied bed, what should the CNA do to promote resident safety? A. Raise both side rails and leave the resident unattended. B. Turn the resident without explaining the procedure. C. Pull the linens quickly to finish sooner. D. Keep the resident covered as much as possible and ensure they remain safely positioned throughout the procedure. Answer D. During an occupied bed change, the resident should remain covered for privacy and be positioned safely at all times. Clear communication and proper body mechanics help prevent injury and maintain comfort. Question 11. This is an essential skill every CNA should know. A resident who uses a walker begins leaning heavily to one side while walking in the hallway. What should the CNA do first? A. Tell the resident to continue walking to build strength. B. Support the resident safely, help them sit if possible, and call for assistance. C. Leave briefly to get a wheelchair. D. Remove the walker and have the resident walk without it. Answer B. Sudden weakness or loss of balance places the resident at immediate risk for a fall. The CNA should support the resident safely, assist them to a secure seated position if possible, and obtain help immediately. Question 12. Read carefully before selecting your answer. Which action best helps prevent the spread of infection when emptying a urinary drainage bag? A. Allow the drainage spout to touch the collection container. B. Empty the bag only when it is completely full. C. Wear gloves and avoid contaminating the drainage outlet. D. Place the drainage bag on the resident's bed while emptying it. Answer C. Proper hand hygiene, glove use, and keeping the drainage outlet from touching any surface help maintain a closed system and reduce infection risk. Question 13. Here's another important CNA practice question. While taking a resident's radial pulse, the CNA notices the rhythm is irregular. What should the CNA do? A. Count the pulse carefully according to facility policy and report the irregular rhythm to the nurse. B. Ignore the irregularity if the rate is normal. C. Record the pulse as regular. D. Ask the resident to exercise and repeat the measurement later. Answer: A. An irregular pulse may indicate a cardiac abnormality. The CNA should accurately measure the pulse according to facility guidelines and promptly report abnormal findings. Question 14. Stay alert. This topic is tested often. A resident on aspiration precautions begins coughing during a meal. What is the CNA's priority action? A. Encourage the resident to continue eating. B. Offer another bite to clear the throat. C. Immediately lower the head of the bed. D. Stop feeding, keep the resident upright, and notify the nurse if coughing continues. Answer: D. Persistent coughing during meals may indicate swallowing difficulty. The CNA should stop feeding, maintain an upright position to reduce aspiration risk, and report concerns promptly. Question 15. Think about what is safest for the patient. During morning care, a resident refuses to brush their teeth. What is the CNA's best response? A. Force the resident to complete oral care. B. Respectfully ask about the reason for the refusal and report persistent refusals according to facility policy. C. Document that oral care was completed anyway. D. Ignore the refusal and never offer oral care again. Answer: B. Residents have the right to refuse care. The CNA should explore the reason respectfully, encourage participation without forcing care, and report ongoing refusals appropriately. Question 16. Let's see if you're ready for the CNA exam. A resident is on strict intake and output monitoring. The CNA notices that a family member brings in a large smoothie for the resident. What should the CNA do? A. Tell the family the drink is not allowed. B. Ignore the beverage because it was provided by the family. C. Include the fluid in intake documentation if consumed and follow facility procedures. D. Throw the drink away without informing anyone. Answer: C. All fluids consumed contribute to intake measurements. Accurate recording ensures appropriate monitoring of hydration and medical conditions. Question 17. This skill is important in everyday CNA work. While helping a resident put on socks, the CNA notices the resident's feet are unusually cold and pale compared to the previous day. What should the CNA do? A. Warm the feet with a heating pad. B. Massage the feet vigorously. C. Finish care without mentioning the finding. D. Report the change in circulation to the nurse promptly. Answer: D. Pale, cool extremities may indicate impaired circulation. Prompt reporting allows the nurse to assess the resident and determine if intervention is needed. Question 18. Keep going, you're building your nursing knowledge. Before assisting a resident to use a transfer belt, what should the CNA check first? A. That the belt fits securely and the resident understands the procedure. B. Whether the resident prefers not to use the belt. C. Whether another resident can help with the transfer. D. That the wheelchair is facing away from the bed. Answer: A. A properly fitted gait belt and clear communication improve transfer safety for both the resident and the CNA. Question 19. Another must-know CNA concept is coming up. A resident who has been on bed rest for several days reports soreness in the heels. What nursing assistant intervention best helps reduce additional pressure? A. Place pillows to float the heels off the mattress, if consistent with the care plan. B. Massage the heels firmly every hour. C. Place extra blankets tightly over the feet. D. Encourage the resident to remain in one position all day. Answer A. Relieving pressure on the heels helps reduce the risk of pressure injuries. Direct massage of reddened or vulnerable areas is not recommended. Question 20. Let's move on to the next CNA challenge. At the end of a shift, the CNA realizes they forgot to document a resident's afternoon fluid intake. What is the most appropriate action? A. Estimate the amount from memory without indicating uncertainty. B. Copy another resident's documentation. C. Leave the record blank to avoid making an error. D. Follow facility policy by documenting as soon as possible with accurate information available and informing the nurse if needed. Answer D. Documentation should be timely, accurate, and truthful. If a record is delayed, the CNA should follow facility procedures and never guess or falsify information.